Amy and her husband lost their daughter Daisy at just over 17 weeks.
I mean, she was the length of my hand.
Yeah. In the middle of their grief and shock, they felt like they were being asked to make big decisions about Daisy's burial at a time when they didn't know how to act.
I didn't touch my baby because I didn't know that I could. Nobody told me that it was okay to actually physically touch her, and she looked very fragile. So I regret that. I wish that somebody had been there and told me that I could do that.
Amy wants to see more trauma-informed training for staff to deal with families when they're at their lowest point.
Different midwives and nurses came in and they were sympathetic and they held my hand, but they didn't know, they couldn't guide me.
Held in Our Hearts is a charity providing counselling to over 100 families. They're rolling out a project in March that would help bridge the gap between parents leaving the hospital and coping with their grief at home.
It's a 3-year project, it's a big lottery funded project, and the hope is that after those 3 years we'll have research and evidence and qualitative information that will tell us that everyone should have this and it should be deserving across the whole of Scotland, and break down those barriers to families leaving and thinking, but where's the care, who's going to come to my door? It will just be, we'll be in touch and we'll come out and sit with you.
A Holyrood committee has called for the establishment of specialist baby loss units, rooms where those who have to go through the trauma of a stillbirth are not surrounded by joyous parents.
One of those standards is making sure that every hospital has a bereavement suite or a room away from the main maternity wards, because at that time, that is one of the most difficult things to have to do, is to leave the hospital with a memory box rather than your baby, and everything has to be done to make that as easy as possible.
The report looked at the need for a greater focus on the barriers facing mothers from ethnic minority groups.
Of course there are particular needs for Black, Asian and minority ethnic women. We perhaps need to do a little bit more work in that ourselves, because obviously our inquiry is quite wide, but that could be something that we want to focus in the future.
Reducing waiting times for perinatal mental health services and a specialist mother and baby unit for the north of Scotland were among other suggestions made to help get parents through these toughest of times. Ivana Holland, STV News.